So today we're going to go over a little bit about, a common problem that is basically, neck pain with numbness and tingling that runs down the arm. Okay, this is one of the more frequent presentations of many of the patients that we see here at Spine Center Atlanta. The spine is made up of different levels and different regions, right? So the neck, cervical, called the cervical spine, sort of the trunk, which is the thoracic spine, and the lumbar spine. And all of these have bones and discs. Okay, the discs are sort of nice and soft, cushion, and then the bones are a little bit more rigid and provide structure. And there are two mobile sections in your spine, both the cervical spine and the lumbar spine. The thoracic is a little bit more rigid because you have the rib cage. Because of that, because there's more mobility at these two sections, those are usually the most common areas that get affected with pathology, right? Most people complain about neck pain, lower back pain. Not as much usually about sort of mid-back pain. These discs start becoming diseased, or if it is affected by any sort of trauma, that disc or these bones can grow and cause pressure on the nerves that come out in this area. And then that would manifest itself with symptoms of numbness, tingling, sometimes even weakness that can run down the neck to the shoulder and to the arm. And each nerve typically goes along a specific pattern that is specific to that nerve itself. Many of these conditions can resolve themselves within 3 to 6 months of conservative care. So lots of times we'll send the patients to physical therapy, try a period of either steroids or anti-inflammatories. If they're in a significant amount of pain, they may require a short period of analgesics. And then there's other treatments that you can do, such as massage therapy. You can do epidural injections, which is a steroid injected into the spine itself that helps with the symptoms. Most common options for the neck are what we call anterior cervical discectomy and fusion, or arthroplasty, which is basically disc replacement. And what that typically entails is removing that soft, herniated, or pathological diseased disc out of the space, and then implanting that space with either a bony block, plastic block, or we could even put in an artificial disc if it's indicated for you. And many of these patients do great. The success rate typically for these are about 90%. And these are typically some of our happiest patients.